You're live, Mr. Chairman.
All right, good evening, everybody. I'm Judge Robert Carter, and this is the February 26th meeting of the Coffee County Opioid Abatement Fund Committee. I'd like to call the meeting to order. Everybody that's present here on the committee, I'd like to announce yourself and your position. And I'm Judge Robert Carter. I'm the chairman.
Lee Nettles, Vice Chair.
Roseanne Smith, I am the secretary.
Very good.
Dennis Hunt, Coffee County Mayor.
Leslie Brassfield, Coordinated School Health, Manchester City Schools.
Very good. And we have a tentative new member here present, Dr. Jeff Keel of
All Creatures Vet Clinic.
All Creatures. I should know that. That's where my dog goes.
I would like to add, Mr. Chairman, if I could right quick, that I was notified by a member that she just didn't feel like she could do justice to this committee, and
Sure.
she wanted to vacate her position. So I've asked Dr. Keel, and he's graciously accepted, but it has to be a confirmation that is an appointment that has to be confirmed by the full legislative body. So he's sitting in here sort of giving us a probationary period, see if he likes dealing with y'all.
Good, very good.
Yeah, better be on your best behavior.
Very good. I guess first order of business is that at our last meeting was January the 22nd of 2025. I think you all should have a copy of the minutes that have been transmitted to each and every member of the committee through email. And I would, unless there's suggestions on any correction of the minutes, I would move to approve the minutes as last recorded.
I second that.
Very good. Now,
Please vote on the minutes. Please take a vote.
all right.
Thank you.
All in favor of approval of the minutes, say aye.
Aye.
All opposed? Okay, the minutes will be adopted as they have been transcribed. When we last met, we adjourned in order to, we did a couple of things at the last meeting. We discussed the availability of the opioid money. We also discussed the fact that we have some deadlines approaching and we have to act with some haste with regard with the money that's already been budgeted. And in that vein, we authorized the county to issue on the county's website solicitations for people in the county that were interested in developing a program that we could fund with the use of this adequately fund that's going to be in line with the purpose and spirit of the opiate abatement funds. We have received those, and we've received, let's see, for the record, we've received recovery is the new high. We've got an application. We've also received Chase Away Fentanyl. We've also received from the Drug Coalition a proposal from Mr. Alan Burnett, the drug court director. And let's see, what have I missed here? Well, at the last meeting, we received a proposal by the district public defender, and that's already been considered, and that's in the record. So have I left anything out? All right, we have some people here today that I think, the purpose of the meeting here today is to begin consideration of these applications. And we have people here today that I think want to give some public commentary with regard to the applications. And I am prepared to take those in no particular order. Who wants to go first?
Did you take a vote to approve the agenda yet?
Oh, no.
You need to do that. Need to approve the agenda.
This is the subject and agenda for today's discussion. Does anybody have any suggestion for any additions to the agenda? All right, I move that we vote on approval of the agenda going forward. All in favor of the agenda as stated, vote with an aye.
Aye.
Any opposed? All right, the agenda for the 26th of February is approved. And moving forward, we're at the point of we're at the point of the meeting where a public discussion is going to be warranted. And like I said, I've invited several people that have got these proposals forward to come forward, and if they want to make a presentation, we're obviously ready to hear you all. I don't have these in any particular order. Who wants to go first? Will, you wanna go first?
I mean, if I need to, you need about 2 seconds. I actually put a PowerPoint together, but,
Yeah.
I don't know if we have the capacity to do that, but I can definitely read the slides.
Do me a favor, come up here if you would. I think you could probably accomplish everything
Do
you need
you
to
have
do.
a standard USB port on that?
Yes, sir.
Yeah, I think we can accommodate that.
I'm gonna move. Yeah, you need to be on the side, come over there.
I hope they got these keyboards. I'll do that. There.
I'm gonna move so I can see your screen.
Oh, yes, ma'am. Yeah, you're fine. No, yeah, excuse me. Oh, I'm so sorry. Yes, ma'am.
Never operated LG, so it might take a minute to find inputs.
There it is.
Should be
That's
it.
it,
Yes.
that should be it.
All right.
Okay. I have a question. You have, are any of these applications yours?
Yes, sir.
Should
Okay,
be.
which one?
Recovery's the new high. This one. Yes, sir.
Recovery is the new high.
Yes, sir. Give me a second. I got a clip
You
in
should
my
have,
bag.
I distributed these where I thought the members were gonna be sitting prior to the meeting. You should have a copy of that application. If you don't,
He does.
Yeah, I
Yeah,
do.
he does.
Okay.
We all
I
do.
do. Mr. Chairman, I might add that in the event, in the future, as far as I can tell, only applicants are in the audience.
That'd
We
be
may
correct.
have a point in time where there is actually visitors that may want to comment.
I've got a
So the
signage here,
public
but-
comment section would be for them. And
Right.
since there's nobody here
We-
that I consider
We do
public.
have a visitor,
We do?
yes.
Do you wish to comment on anything on the agenda?
No.
Okay, so that clears that up, but that's how you handle public comment
All
would
right.
be, so that's the item in order of our standard agenda format.
Very good.
Proceed.
Take it away. You got the floor.
Yes, sir.
Or as I like to say, your witness.
Don't put me on the. So yes, I'm Will Taylor. I'm a representative of Recovery's New High. Our proposal title is Empowering Communities Through Recovery Education. Our general mission statement is to provide education, advocacy, and consulting that fosters the establishment of recovery-oriented practices within the community. Our vision is to have a community that collaborates and creates what is referred to as the recovery ecosystem, an evidence-based model that encompasses all aspects of community relations in support to recovery, where individuals can experience that unparalleled high of long-term recovery. So our project goals that we've outlined here is to foster community-based recovery education and advocacy. The project aims to increase awareness and support for recovery efforts. Continuing with the overview, community education initiative interacts educationally and with recovery events. So our proposal is to host a series of educational-based events and trainings open to the communities, but then also tailored specifically to professionals in our community to have subject professional matters come in and speak to certain topics. as well as host 2 recovery celebrations, focusing on recovery strategies, harm reduction, and peer support services. The events are held in partnership with different community agencies throughout the county, our faith-based partners, and even offering them on virtual platforms. That way accessibility is met by everyone. Continuing with our objectives, we want to increase the awareness of substance use and mental health there that fall into the remediation list. All of our trainings are based on evidence-based knowledge and practices. Connect attendees with recovery support services and resources, and to reduce the stigma through the community engagement. So our activities there are 8 community-based recovery educational series. Again, I did forget out our 2 recovery celebrations there. Again, expert speakers talking on to the subject matter, along with peer support. Identification is the most important language in the recovery model there, because if individuals can't identify, can't self-relate, there's a big disconnection there. Offer hands-on workshops, trauma-informed care, navigation of treatment, and education centered around harm reduction. Providing self-employment and life skill resources. Part of that recovery ecosystem does include back to work skills, life skills with that. So how are we going to measure these outcomes? Of course, data collection, pre and post surveys there. Also, some measurements we look for is that increased awareness and understanding of what recovery, treatment, and other topics may be. Strengthening that recovery support network. Ultimately, collaboration is part of that ecosystem model, where we need full collaboration to really emphasize and implement a recovery ecosystem model here. What I mean by that is Coffee County has a lot of resources. Number one, a lot of times individuals aren't aware of that resources until they're in time of despair, right? So we want to be able to take that and present a live database back of resources that are there. That way they're spontaneously instant access. But then also getting collaboration together for those resources. For instance, I'm going to pick on my friends, Chase Away Fentanyl. Really do a lot, and we've done some partnerships even with harm reduction. So being able to say, hey, we can offer this service, but then this organization can offer this service as well. Enhance access to recovery support services. Recovery is not just treatment. Recovery falls on a continuum as well. It's important that the community understands that, and making sure that everybody has access to all aspects of that continuum, no matter where they fall on that. Again, success is measured by attendance surveys and engagement within the recovery service. We're going to implement that recovery ecosystem model. So you hear me talk a lot about the recovery ecosystem model. This is all the 8, or we have expanded it now, but the dimensions of the ecosystem model, again, vocational rehabilitation, our faith community plays a vital part in that, our justice system, because Tennessee runs a survey, 88% of individuals that are justice involved are correlated back to substance use or mental health services. So making sure that individuals have what is referred to as an exit plan there, options for when they are released. Public health system, understanding and really working with our public health individuals, because not all individuals have access to same quality of care, right? So a lot of times, individuals may have to utilize our health department for resources instead of a private PCP. And of course, we work on around the ecosystem there, collaboration with other nonprofits and workforce development trainings. We have a letter of support from our community, Tennessee's Health and Human Services, and just collaboration and helping the training services there. So the recovery ecosystem refers to a network of interconnected resources and services, and supports the enabled individuals to achieve and sustain recovery with substance use disorder. So in conclusion, the Recovery Ecosystem Education Initiative represents a vital step towards empowering individuals and reducing stigma and strengthening community. These are some projects that Recovery U has already done with Chase Away Fentanyl in the recovery court, equipping naloxone access box, as well as one boxes inside the Justice Center. And I will take any questions if that's appropriate, or
Where do you get your individuals from? How do you advertise? How do you find the people that need your help?
So Recovery's New High ultimately is very active in the community already through social media and just through general interaction in the recovery community. Work closely with state probation and working through partnership with Recovery Court as well.
Okay, so you're working through
This is to
recovery
augment
courses.
existing financing that you already have.
Correct.
Yeah.
So naturally, what we are, we're a statewide organization. Our mission with this organization is to implement the recovery ecosystem model at a county level because that's where it's most effective.
And I saw that. I seen where you had the anticipated number of people that you were gonna be helping this 5,000, and 100% of the monies that you're asking for is going towards the helping of those 5,000, which are in Coffee County.
Yeah.
Okay.
And implement of everything, all the budget, 100% goes directly
Right,
back in here.
cause I seen your budget and I saw where you had this, but, so I was looking at that's statewide, but you're asking for an additional 30,000. And then I believe I read in there where you were saying that it was gonna be purchasing, the venues of where you have your meetings and your get-togethers, plus your, all the, paperwork and manuals that you need.
Correct.
Okay.
Yeah, everything 100% would be through that. Currently even, naturally, we hope to have partnerships, but ultimately we've even talked to, for instance, this past year, working with Parks and Rec, there's still a fee that comes with renting that facility, right?
You're right.
Even insurance and things to cover that. So again, 100% of the ask is directly allocated to services here. There is a position of CPRS in there that's to be determined, because if we get that, ultimately we will
What
provide
it
peer
took-
services.
Explain that to me, CPRS.
Certified peer recovery specialist.
Okay.
It's an
All right.
individual with lived experience
Yeah.
that has been through the state's
Yes.
training, and carries a credential.
That is something we are interested in.
Correct.
Yeah.
And ultimately, the goal with that, in speaking with the individuals at the Justice Center and the Sheriff's Office, was exit planning. So one of our future boxes that will be going is going to be inside the lobby of the Sheriff's Department. So when individuals are released out, they have contact to, hopefully, this CPRS, to where we can do access to services, whether it's housing, whether it's like, hey, you know what? I've had a moment of clarity while I've been incarcerated. I'm ready to go to treatment.
I went to a drug court thing in South Florida last week, and that's what they talked about. Somebody that's discharged in the middle of the night that's been serving time on a drug case, they get out in the middle of the night.
Nowhere to go.
I know where they're probably gonna go.
Right.
So you gotta, your peer recovery people would they cover that particular?
We're not
That's a
at-
particular problem.
We're hoping to combat that problem, but that issue. Our ask is not to staff that full-time. What we're wanting to do
Yeah, I
is,
got that, you couldn't.
Because-
It's not practical, but.
because initially, our ask is when we collect this data, because currently Recovery's New High partners with MTS, use data analytics. So every project we run, we're running through a data analytics. That way we can get that instant report back to say, hey, these are our services. This is where we need to adjust our services to meet the need. Hopefully, if we get that, because personally, an individual in long-term recovery, that is justice involved, I know the deficit of individuals, again, getting released, unfortunately, at times of 12:01, right? If there's no exit planning initiated there, ultimately, individuals go back to what they're accustomed to, and ultimately, that's something that's probably of an adverse environment, situations
Well, I
like that.
think that's where a lot of your unemployed deaths come from, is people that their immunity has been degraded while they're incarcerated, right? And they get back and they think they can pick right up where they left off. That was a particular problem that they discussed at this thing last week.
Correct.
Is that, you're talking about something to head that off.
Correct. So through these trainings, and let me know if I'm taking up too much time, because I do sometimes
No, we
get
got-
carried away. I'm passionate
we're
about it.
good.
But through these trainings, partnering with our faith services, right, our faith communities, you may be saying, well, we know the importance of that, but what truly is the importance of that? Also, Barnabas Institute's a national faith institute that really pulls surveys on faith institutes, right? I personally even spent the last 7 years working for the Tennessee's Department of Mental Health and Substance Abuse Faith-Based Initiative. A survey that we pulled, 98% of services that are implemented inside jails or prisons come from a faith institute. So our partnership is going to be training them up, because they maybe bring meetings in there, whether it's a Bible study or anything, but they can also help direct who's serious, who's really interested, who's asking questions about, what do I do when I get out of here? Is there housing? So then coordinating with our, hopefully staff, our certified peer recovery specialists, it will just be the passing of that continuum of warm handoff model there.
Just out of curiosity,
Yes, ma'am.
how easy is it to find a certified peer recovery specialist? Because behavioral health specialists are so needed and they're so hard to come by these days, and you're in that business, so you
Correct,
would
yeah.
know.
Well, so, not to toot my own horn, I'm actually a trainer for that model for the state. And also Recovery's New Highs Institute, where we're able to help individuals because requirement of that certification is they have a minimum of 75 hours supervision. I myself as a supervisor, my whole staff at Recovery's New Highs is a supervisor, so we have a working network with peers.
Okay.
So this is just a way that we can actually, ultimately, starting out would be contract them, paying them stipend pays for their engagement, and then hopefully get data and maybe come back and present to y'all, next year or something, right? But ultimately, we got to start somewhere.
Do you envision budgeting for training of other?
Yes, sir.
Okay. How long does it take ballpark to train somebody up to that?
To become a certified peer?
Yeah. I know you can't.
Well, through the state model, requires 2 years of active recovery from mental health or substance abuse, and then it's a free 40-hour training. Outside of that 40-hour training, then they have to require 75 hours of supervision.
So you gotta take, you want somebody that's been in recovery for 2 years, and then you provide the add-on training.
Correct.
Okay, all right.
Now, there is a step around to that. I try to support Tennessee's model because we're in Tennessee, I'm a
Sure.
volunteer, but there's a national model called the Recovery Coach.
Sure.
It does not require any active period of recovery. It basically uses the terminology, you're in recovery when you state you're in recovery. I personally, and especially working with our justice involved and justice system, I tend to hold on to the state's model because, again, we're working with jail administrators and jail staff. We hire a peer, they're gonna be a representative of Recovery's New High, right? So they're not only representing themselves in a setting like that, they're also carrying our name with them. And so we wanted to make sure that, emotional balance is leveled out through that process.
Yeah. Okay.
If I may, this is a startup program.
Yeah, this is startup, we're rolling, this has been implemented in other counties.
This start for our county.
Starting for your county, it would be, yes,
Okay.
a pilot for your county, because nothing's been done here for that.
And you said statewide, so are you heading up, actually presenting in all 95 counties?
Not say all 95, but close to it.
Okay.
And we're actually submitted with the state OAC, and actually federal grants as well. Like I said, I personally, my last 10 years has been with the Department of Mental Health. I stepped away with that to start Recovery's New High because ultimately more needed to be done. I love our state, but ultimately we're slow implementing things, and that doesn't sit well with my spirit, personally.
So it looks like, if I understand it right, most of your outreach is through workshops and events, is that correct?
Correct.
Is there anything, like if somebody just is day to day, if somebody needs your services, is there a contact? Is there is there any, daily
Like access to us?
resources? Yes.
Correct. So like in these resource bags, they have our information in there on how to get a hold of myself directly right now. Ultimately, what we hope with this project is, like I said, there's a position in there for a certified peer recovery specialist. So they would have access to that, right?
And that would be for the county, Coffee County?
Correct, the county, 'cause that-
So right now, if you don't have that, are they talking to somebody in Nashville or?
Are they, yeah, they'll talk to me or one of my team members, correct? Like, are you talking about a program that's like with the resource bags?
Yeah, like if somebody needs,
Correct,
if
yeah.
somebody's just trying to reach out and contact you, and
Yes, sir.
maybe they don't feel comfortable coming to an event or a workshop,
Yeah.
how would they contact you? And that's through these resource bags then.
Right, they have my information out there, plus our website has a live chat. Matter of fact, last week I got a message from a gentleman just from Recovery Housing here locally, right? Our name is pretty catchy, right? Recovery's the New High. A lot of people think that's unconventional, but honestly, it's intentional. Personally, again, I'm an individual in long-term recovery. One of the things that motivated me to buy into the recovery process, and this is even at 12 months, right? Because at 12 months, I really wasn't for sure. I had a lot of judicial intervention, right? That anvil gets, when it's up on your neck, it gets highly
You had a lot of
motivated.
therapeutic justice.
Yeah, justice
That's a
love
term
today.
I learned down there
Yeah,
last week.
absolutely. But I say that because I was introduced to this slogan. And I'm like, man, you know, this is at 30 years old. So ultimately, it kind of motivated me with the individual that introduced me to this slogan. And it's like, what's it about? That individual mentored me and modeled me. And then ultimately, I started working with him at the state level. So that's ultimately how this organization come about, is how can we take this. Our goal really at this point is not nationwide. We've had opportunities carried nationwide, but to statewide. I mean, I'm a volunteer. Our team is 100% volunteer. Our team as a whole, we have 70 years of lived experience there. So I mean, ultimately 6 out of 10 individuals come from the State Department of knowing how to navigate the systems and navigate the State Department. So the evidence is there in our team on how to navigate the system out.
So right now your team is about 10.
Right. We have some what we call ambassadors, because ultimately we're not fully funded to have like stationary positions, so we pay them stipends for their services, their time doing it.
So they're kind of like contract employees.
Contract, right? Yeah.
Okay.
I got one more.
Yes,
On
sir.
the, in your annual operating budget, grants and government funding, you got it $800,000. Do you expect that to be totally funded by opioid abatement grants from individual counties?
The majority of that's actually state level.
Yeah, I
Gotcha.
figured.
And again, annual operating, so we projected that. We have over $1 million in state OAC grants, right? Now, that is not directly allocated to peer services. Really what we're doing there is providing the training services to build the capacity of education, right? Again, my experience has shown me that a lot of individuals want to have a role in this. If you notice that our mission statement, it's a puzzle piece, because I'm a visual learner, so I have to use illustrations, right? So we use the analogy of puzzles. Everybody has a piece of the puzzle, they're just not for sure where it fits, right? So by the training and providing those evidence-based practices and showing them how, it really ignites that motivation in them to really see where their piece of the puzzle fits in at. It may be directly with child services, right? And the youth. It may be doing individuals on the other end of the continuum of like post-treatment, aftercare, things like that. But great question. I'll answer that. Oh, sorry, yes, sir.
You've got envisioned a couple of events per year. Those are, I guess, educational events. Is that right?
So our proposal was to have everything implemented within a 12-month period.
Yep.
I was under a misunderstanding with y'all's application of the funding period, of what the cycle looked like, so I just assumed it was a 12-month period, and that's how I wrote that out.
That's fine. What are those? Tell me what those events look like in your mind.
Ultimately, a lot of community events. I specifically have one in mind that I would love to have elected officials and just really bring in subject matter experts, right? To really
Like you mean like a forum?
forum style, really just general education
Okay.
model, right? On understanding true addiction. And I'm not saying you need it, but again, my personal experience, I covered 45 counties, all of Middle Tennessee.
I mean, your target audience are parents or young adults. What?
Some of them will be catered to different demographics, right? Some of them will be catered to younger adults.
I
and-
mean,
and
I think
youth.
people in here are kind of that's a particular point of concern for people on this committee. I think
Correct,
children and young adults.
correct. But ultimately, I have to get to the parents too,
Sure.
right? To
Right,
educate,
right.
to educate them as well. So that's the key to it. Ultimately, from a liability standpoint too, when we start working with youth, we have to look at consent levels and things.
Sure.
So how, what's the youngest we can be
Okay.
there? And that's where a lot of our even collaboration comes in, and things with other partners that maybe even have that access to working primarily with youth.
All right.
So this is mainly recovery support, not necessarily prevention.
It is prevention.
It is
It's-
prevention?
Yes, ma'am,
Okay.
evidence-based prevention models.
All right,
So it falls under, out of the remediation list, it'll fall under prevention and education and training.
okay.
The data support that we run with MTSU's data analytics, and then also recovery support with the CPRS services.
Okay. Thank you.
Yes, ma'am.
I have a question. So have you done, can you give an example of an event in a county that you incorporated parents and young adults maybe? How did you get to those parents? I mean, parents are not interested until they're in the middle of it.
Correct. Yes, ma'am. So a lot of times it comes through collaboration, right? Actually, this past year, we collaborated, especially around Halloween, with like trunk or treats, right? And models like that we know that parents are gonna have their youth there. So, because when we really are investing into a set training, for instance, like if it is the parents, we have to be careful what information is delivered that is conducive to the parents, but maybe may not be conducive to the young adults in that setting, right? So really having an incentive, so really partnering with our faith communities that offer trunk or treats. That way, number one, there's childcare there, there's services there that can help oversee the children while the parents are in a training session like that. And then also the total opposite of that as well. Sometimes we may do things, especially during the summer times, to bring youth in to kind of, in a model of like a parents' day out setting where we can really invest into the youth during those times as well. And it's not so much geared around the parents.
As county executive who takes care of, or an employee takes care of our website, did you find our website user-friendly?
I did not.
Okay, tell me a little about it. I'll be
Are you
asking all
sure?
right.
I'm gonna try to be honest, and I
Okay.
want you to rate my proposal first. If you notice my applications, I created them myself off of the template that y'all
Yeah.
gave me. Number
Okay.
one, it's not fill-in friendly. Number two, I had to call your office and actually speak to both secretaries. They still couldn't provide me the template. I had to reach out to Smart Initiative to get the template. The work plan, I had to reach out to Alan Vickers because when we click on your link under forms, it only pulls out the general template and none of the other access points. That template there is not fill-in friendly like a PDF or something where I could go in, so again, I created
So
those.
you prefer when you open the template that it's editable online, that you can actually start filling, is that what you're looking for?
For an individual that works in the grant nonprofit world, that's the standard.
Okay,
Just that.
all right. We were just furnished, I mean, we're new, we're brand new.
No, yes, sir, yes, sir.
Right.
I'm not complaining.
Right,
I mean,
these are the
I-
full power authorities given.
So CTAS provided us with those templates.
Yes, sir.
And, we just transferred them to our website.
I let them have it too, because they just received $3 million for the next 3 years to provide services, so, again, we're an advocacy organization, I made sure that they helped
Okay.
out with that, is on y'all's behalf as well, but, yes, sir.
And have you presented to it personally? Have you presented to another county for this like kind application?
Similar model, but yes, sir.
Okay, now, so that's where I'm going with this. Was their application process considerably easier? I mean, so,
We're talking apples and oranges at this point,
really,
yes, sir.
tell me which county that was.
Rutherford County.
Okay.
Cannon County.
Cannon.
Williamson County, I mean, again, Lincoln County, and I'm from Lincoln County. you know,
Okay.
so it's-
Well, I know all those people.
And it's not y'all's fault, you know, because honestly, I let Trevor and CTAS and the Smart Initiative have it, because like I said, they just got awarded from the state level a little over $3 million for this, so if providing services. making
Why
sure-
was theirs more user-friendly, if you don't mind me asking?
Let's just say they expanded things out a lot more.
Okay.
There was no deadline on the application, all that was on there is a form. I couldn't even find the minutes from y'all's meetings. If it hadn't been a word of mouth, I wouldn't be here today and y'all wouldn't have my application
Well-
today. And again, it's not y'all's fault. I know this whole Tennessee statewide, the Abatement Council as a whole is new, right? Everybody's learning.
Yeah, you know, we've heard about the opiate funding for some time, and then now that it's here,
Correct.
We feel like we're put on a little bit of a short rope.
Yes, sir, ultimately. I know the mayor, when he just come on, we had an event in Middle Tennessee's university, right? That brought together all Middle Tennessee, mayors and things and kind of laid out, because MTSU, I'm not pitching them, but ultimately, a lot of the counties they work with, things are a lot smoother. I mean, they have a representative, ultimately, they would grade y'all's applications and then bring them to you to vote on. They do a lot of your legwork. I mean, yeah, they do take a piece of your commission, but they also hold community grant writing classes and things out there, you know.
Do you work with Cindy Chafin at MTSU?
I do, yes, ma'am.
Okay.
One more, in our
No, yes.
defense, this is
No,
only our
don't
second.
I promise.
This is only
I hope
our,
your vote don't count, Miss Mayor.
it don't.
No.
No,
This
you
is
got
only our
immunity. You got immunity.
Our second business meeting.
Okay.
We have one prior meeting that was more or less an orientation
Yeah.
with
Yes, sir.
CTAS.
Yes, sir.
So we're just, and also in our defense, we lost the previous mayor
Yes, sir.
unexpectedly.
Yes, sir.
And that upset the apple cart, some
Quite a
wheels
bit.
fell off,
Yeah.
a lot of stuff. So we're playing catch up here.
No, and I think y'all are doing a great job. I mean, ultimately, because I do know the time restraints y'all are under to keep the state from coming and take the money back. So, I mean, I was happy to see it, you know. You asked me, could it be improved? Yes, sir.
We will work on that.
Thank you for that input.
Yes, yeah, thanks.
Constructive criticism, right? That's,
Yeah.
That's always welcome.
yes. If there's not any more questions, though, I thank y'all.
Thank you.
I got a little warm up here under all that. I usually don't.
Will there be another presentation?
Yeah.
Okay, then I'll stay over here.
Yeah, now that Will's broken the ice, everybody.
Yeah, everyone's. Make sure y'all keep that under mind, you know.
You might wanna leave that open. And your laptop.
Oh, you need my laptop to
Go on up further. Go for it. You got your.
All right, we weren't planning on taking these in any particular order, but we're ready to receive the next presentation.
All of that? Go. Oh, gosh.
That way you can leave when you're done.
That's his.
Yes.
This right here is gonna be short and sweet. Hopefully.
make sure that remote works. Okay.
All right, you guys. My name is Alan Burnett. I'm the Recovery Court Director here in Coffee County. I just started in May. I'm also a person that's in long-term recovery. I struggled with addiction a little over 20 years. Just celebrated 18 years of sobriety. Ever since I've got clean, recovery has become something that's been very passionate to me. Every platform that I've had, every opportunity that I've gotten to get up and say something and make a difference, I did that. In 2013, from working a lot with Franklin County Prevention Coalition, facilitating a class that's near and dear to me, more reconation therapy. My employer at that point in time, the Tennessee Lifeline Peer Project, became available through the Tennessee Department of Mental Health and Substance Abuse Services. So they reached out to the embedded coalitions across the state to see if they had anybody in their communities that had long-term recovery, 2 or more years in recovery, to go out and cover so many different counties across the state, reducing stigma related to the disease of addiction. So my former employer, she thought that I would be a good fit for that because I was a face and a voice of somebody that was in long-term recovery. So with that, I went into a lot of different rural communities here in South Central Tennessee. Coffee County was one of the areas that I covered, and Coffee County was one of the areas that did have a coalition. Franklin County was an area that had a coalition. Out of the other 13 counties that I covered, there was not a coalition. And right before COVID came, we ended up having a coalition, whether it was a prevention coalition or a faith-based coalition in every single county. So how did that happen? I went to those communities, being a face and a voice of someone that's in long-term recovery, talking about what I've been through and how I was able to get to where I am now. So whenever I started this job, I realized that Coffee County didn't have a coalition. And the coalition that was here before, it was very, I felt like it was strong. It was like one of the stronger coalitions in the state. And whenever I got here, it was gone. So I feel like, or I think that I was brought here to help establish a new prevention coalition. Well, prevention kind of keeps us limited. So thinking about taking and changing that name to a Coffee County Collaborative Coalition, because that's what I've been great at, is being able to collaborate with all of our communities. So we are going to use the strategic prevention framework, doing assessments, building capacity, planning, implementations, evaluations, sustainability, and cultural competence. And we look right here at capacity. I've been here maybe 10 months, 10 months right now, and we've already been doing, from the time that I've been here, is building capacity. Reaching out, building relationships with different organizations here in the county. I've been to just about all of the schools, I think, here within the county, trying to get in and bring resources for those children. Also, with having a coalition, we will be able to bring in state agencies, state-funded agencies like the Tennessee Alliance for Drug Endangered Children, who works with TBI, Tennessee Counter Drug Task Force. I'm also a board member for the Tennessee Alliance for Drug Endangered Children, and also bringing in Handle with Care, and also being able to partner with TATIS. I've already built relationships with the Coffee County schools, law enforcement, recovery court, local county government, businesses, the health council, and the media. So we will utilize media to more or less help us to get the word out about what we're trying to do. This right here is some youth activities of what we've already been doing. This up here in the left corner is being able to go into the schools and do Libby, or not Libby, Lamby Learns Addiction. So this right here is a little bitty bunny that a good friend of mine, she created a little storybook, and it's told by a child. It's a storybook that's more or less told from a child's perspective, I should say, about what went on in their family. So they utilize this Lambie right here for kids who may be going through a hard time, utilize that Lambie for comfort. But I'm able to go into those schools and talk and read that book, and those little kids ask questions whenever we start talking about addiction. If they know anything about addiction, they start throwing their hands up. And it's a slick way that I've used throughout the years. And if the teachers are paying attention, they see those hands go up, then we are able to identify which kids or which families may be having a hard time with addiction or struggling with addiction. And then we can actually go into those homes and provide resources, education, that sort of thing, to heal that family right there. That's it. Robert E. Lee, I believe. This right here is Westwood Elementary. And whenever I took that picture, I stepped back one day and I looked, and every single kid that's right here is Hispanic. And that really caught my eye because, I mean, usually everybody that I'm working with, they're either black or they're Caucasian, right, or white. But this right here, I mean, man, these guys right here need resources too.
Which school is this?
Right here, Westwood Elementary.
Okay.
Right here is Westwood Middle School, and all of these are, and this down here is Westwood Middle School also. But these right here are after-school programs. These right here are. So with these after-school programs, actually, I looked up one day. I walked outside of our recovery court office, and I heard across the street a lot of kids just rambling. And I'm like, man, these little kids over at College Street Elementary, these kids are outside playing, and I'm saying to myself, why am I not over here doing something? Because at my previous job, that's what I did after school, is I worked with some kids at least twice a week. And it made a difference because it's mentoring to me, and it's able to get in and identify what's going on in those families and provide a service for them. So I believe it was right around Halloween, sometime like that last year, whenever I first started going out to the schools, I thought about, we need some kind of activity to do with these kids. So I thought about flag football. Anyway, I shared it with one of the teachers whenever I went to Westwood Middle School during Red Ribbon Week, and she really liked the idea. And then once we came back after Christmas, she brought it to my attention again. So here we are. We have started a flag football league here in Coffee County with an after-school program. And I mentioned it to
Coffee County.
Coffee
Coordinated
County
School Health.
Coordinated School Health. I always want to say Board of Education. But she liked the idea, and now she's incorporated it into Coffee County Middle School. So at the end of the year, we are going to play against each other. It's going to be Westwood against Coffee County Middle School. So some potential collaborative prevention and educational activities, Red Ribbon Week, drug take back events, town hall meetings. I know Brother Will had talked about doing town hall meetings, youth activities, educational trainings, and awareness campaigns. When's the last time has Coffee County done a drug take back? It's been a while.
Over a year and a half.
Yeah, it's been a while.
So that's something that we need to bring back. Town hall meetings. I have talked about doing town hall meetings already this year, but just having that collaborative togetherness, it's kind of difficult to put those town hall meetings together and not having the funds. I could do it utilizing recovery court funds, but that's kind of not what I'm supposed to do. But that is one thing that I really intend on bringing to Coffee County, one way or the other, is town hall meetings. I've seen town hall meetings probably for the past 12 years, and how effective they've been, and how effective they've been because of the education, youth activities. Being able to take youth or our youth to like TCI, CADCA. That might be too much. And then doing educational trainings and some awareness campaigns. That right there is pretty much it for that PowerPoint. So, but that right there is just a PowerPoint. The importance of a coalition. There are 48 different coalitions embedded that's state funded throughout this state. And I have seen how a functioning coalition have made a difference in every single community that they are in. They have the resources, they have the trainings. We don't have that here. And I think that's sad. And that's something that I want, I believe that's why I was brought in here, is to help establish that. I've already been doing the work here. I've gained a lot of different partners from the time that I've been here. And even though I may have just started recovery court, I've been here for a long time. I've been helping this community for a very long time. I am a certified peer recovery specialist. You guys were talking about like people calling recovery's the new high and how are they gonna provide services for them. I get phone calls all the time. Certified peer recovery specialist. When I go home, on vacation, nighttime, laying in bed, it may be a message or whatever. My family needs help, my family needs treatment. Is there anything that you can do? Yep. In a matter of minutes, I've provided a service for them. So being able to have that knowledge, let's just say for the past 12 years, being able to have those resources to bring in to make a difference here in this community, it's easy, but it's more difficult if you don't have the support. So that's why I believe you guys have asked me to help you guys to establish a new collaborative coalition. I could talk all day pretty much about our coalition and about what we do. This stuff up here, it really doesn't mean anything to me. Like our work plan, our budget plan, every bit of that is in your packet. I do have plenty of partners. I did talk about,
We're really talking about salary augmentation for you and an assistant. That's where we are, right?
yes.
Okay.
Yes. My understanding, like whenever I came in here, as far as recovery court director, and to also help get this right here established, that, on down the line, there would be room for increase.
Yep.
And like, that hasn't happened. And we're here now trying to establish this coalition. So some of those funds would help supplement the work that I'm doing as far as the coalition, but being able to bring in a highly qualified assistant to help with recovery court duties as well as primary focus coalition duties.
And data entry.
Data
You're gonna
entry,
need a lot of that.
every bit of that, but also helping to bring in like trainings, different resources, things like that right there.
All right.
Building capacity.
So you're getting ready to have recovery court clients, actually, right?
Yes.
We
Okay.
finally got the go-ahead from the state
Okay.
last week,
But
so we're
I see
screening
you're the
clients now.
recovery court director, but this money is for the coalition.
Yes.
Yes.
And so this is
Right,
for
that's
the
right.
kids. This is,
This right
this is for
here.
9,600
I mean,
children.
we wanna be able to focus on substance misuse as well as vaping, tobacco,
Yep.
and alcohol. So that's gonna be a lot of kids.
It's a little bit more expansive than just the charter aims of the recovery court, that's right.
Yes, but
Right.
a coalition will be able to serve the entire county.
Yes, no, I understand that. So,
Yes.
but whenever I looked at it and I seen project director was Coffee County Recovery Court Director, and then I was reading the salary and it was talking about the coalition director, and I can see that the organizational name is Collaborative Coalition and your description is for it, but you're here to educate and help children. That's, and cause I see your pictures of the schools.
Yeah.
Am I getting that right?
I wanna help us all.
All right, I understand, and it starts with kids. I appreciate you.
I wanna help us all, and, you know, we say kids, but there's a lot of kids that's locked up inside of us adults.
Yeah, I know.
And once we can free them up, I
He
believe
takes
that's
a
gonna
pretty
make it.
expansive view of the word kid.
Yeah,
Well, when I say,
I
the
do
reason
too
why I
now.
said children is I saw your picture, I
Yes,
hear
sir.
you talking about flag football, I read your packet and I see bunnies, you know,
Mm-hmm.
when I see those programs, we're starting at a young age to educate.
Yeah.
Oh, yeah.
And it goes all the way through.
Oh, yes.
But you're also, once these children, you create that relationship, it will run into recovery court.
Yeah,
I promise
oh, yeah.
you.
Oh, yeah.
It will run into recovery court.
Yes.
You're gonna build a relationship that's gonna continue to flourish years down the road because of what you're doing with kids.
Yes, sir, absolutely.
I understand.
I've been doing this
Yep.
for a very long time. Those kids is something that I'm very passionate about, because I was that child before. And I believe that everybody in here has a child or a grandchild, and I wanna make a difference so that those kids, those children, those families have that opportunity to live.
It will be
You had
great to
some
have
similar
some.
obligations over in Franklin County before you came over here, right?
Yes.
Yeah. Yeah, you might wanna give them the background.
Yes, I mean, I've helped establish or put together like town hall meetings, medical forums over there, as well as faith-based, forums. Let's see, I've talked to a lot of different schools. I've talked to, probably about 1,700, students over at Franklin County High in one day. And I don't think that you could actually hear a pin drop. And not just Franklin County, but into other schools, clear across South Central Tennessee. I've been to Atlanta RX Summit to speak. I've been to Kansas City to speak, with our DEC conference, Washington DC to speak. You guys might think that I can't speak, but I can run my mouth. I'm just nervous up here with this stuff right here, but I do know what I'm doing. This ain't my first rodeo, and I am a difference maker. I am a change agent, and I promise you that I will make a difference in this community. I have been making a difference in this community, but that's our proposal, and I believe everything that's needed is in that packet.
I got a question.
Oh.
So, who is who will be the coalition director?
The coalition director?
Yeah.
Well,
You?
as far as I see it, I'm to oversee it.
And who is the coalition, do you predict will be the coalition coordinator?
That is to be determined.
Okay.
I've got some pretty good people in line, but I do think that
So the
there will be an
director's
application
salary,
process.
the director's salary will be on top of what you're already making, right?
Yes,
Okay.
yes.
Question on the second page, the meal per diem, is that for a conference trips or
Yes, sir.
trip?
Yes, sir.
How many trips would that involve for $5,000 worth of meal per
How
diem?
much is, what is going toward the director's salary of that 160?
50, and then 20 on top of what he
Oh,
already
okay, all right.
received.
Okay.
That right there is for like events and stuff like that.
To
Right there.
feed multiple individuals?
Yes, that right there is what that right there
So
is
does
for.
this carry over then for multiple years or what?
Well, like he pointed out, the timeline for the grant funding was not clear. What we all agreed on, I think, was look at this, get this initial funding going in the direction it needs to go, and then revisit in a
Right.
year with each
That's right.
project.
This
That was my
this is
understanding.
a multi-year envision. This stuff's gonna tail off over a period of time, but it's projected out to pay out for several years.
Okay.
18 years to be specific,
And
and
there
we're
towards the
already
end
in
of
the
18 years,
second
it's,
year, right?
I mean, it dribbles out towards the end, but we're talking about substantial early funding,
Okay, so it's heavy weighted on the front end.
heavy weighted on the front end.
And
We've
what-
excuse me, I'm sorry. We've already been functioning as a coalition, so to speak, somewhat, for almost a year.
Right.
Okay. Being a functioning coalition for 2 years, we will be able to partner with people like the Tennessee Alliance for Drug Endangered Children. They will be able to bring a drug endangered children coordinator in here to provide services and trainings handled with care. Will be able to come in here. Also, you got the Counter Tennessee Dangerous Drug Task Force to be able to come in here and help us to make sure that we're running and functioning as a coalition the proper way. And then we also have other different resources that's out in the community that can help us and assist us with that too. I know a lot of people.
I have a question.
Yes, ma'am.
Alan. On here, the school liaisons,
Yes, ma'am.
what does that look like?
Okay, that right there is gonna look like with, us, and I feel like that the flag football thing type deal, I feel like that it's gonna grow. So whenever we start incorporating more after-school programs or more activities for the after-school programs, instead of, because I can't be everywhere at one time. So we hire one of those, school teachers or whatever to be that liaison to head that up.
Like a stipend for
Yes, ma'am.
somebody at
Yes, ma'am.
each of those locations?
Yes.
Okay.
Money that we've received.
Every week, you're gonna try to
Individuals
get with
that
all the schools
pay
in Coffee County.
That's my goal.
That's
Yes.
good.
this
I seen you hit East Coffee, and then I heard you talk about the middle
This is
school,
what
so.
we have to
And
get
there's a
spent pretty quick.
lot of
Okay,
schools.
all right.
Y'all got a big job.
Oh.
Big job.
Three
So-
school
and so when-
districts
when
in
they
one
make
county,
these
yeah.
decisions,
I've been
We
doing
have
it.
to fund it.
I've been
If he's
doing
asking
it.
for
I've been doing it
160,000,
already.
If we choose to.
But my goal is
give
to
him
kind
money, do
of,
we have to give him the 160,000, or can you?
kind of do like a
It'll be
Trump,
budgeted.
like
Yeah, I
President
think
Trump.
it'll
Secure our
be in
borders,
there,
right,
and we'll
and start
probably
working from the
Marion will
border.
be Divvying
Right.
out
Yeah.
payroll, we'll probably have to take care of the payroll
I understand.
and all that, so, that's how it works.
And so I don't know much about the recovery court. So I'm assuming you work, your other job is the recovery court? Because this is on, this 20,000 for the director salary is on top of some other salary that you receive. Where is that, what is that salary? Well, I mean, where are you receiving that salary from?
My recovery court?
I guess, whatever
That's a
your other
direct pay
job
salary
is.
from Coffee County government.
Yes.
Okay. And so what is that? How much is that salary?
My salary for that?
Yes.
Right now, 65,000.
65, so you, basically another 20 on top of 65?
Yes,
Okay.
He started lower, he
Yeah.
proved himself pretty quick, we gave him the 6-month probationary period and gave him, enough raise to what, buy a new boat and car?
But he was hired in April of 2024, and the idea was increasing responsibilities, increasing salary.
Okay.
Did I say that right?
That's pretty
I think
pretty
we're
good
saying the same thing. I think
characterization.
we're just saying it a different way. All right.
And I apologize for my ignorance. I
No, you're
just
fine.
don't know anything about.
You're just
any
late
of
to the
this.
party. You're not that
Yeah.
much far behind us. Don't worry.
I feel pretty
I'm new
far
to
behind.
this as well, so I'm learning also.
Okay, appreciate that clarification.
All right.
But when we're funding these, and that's, I guess gets back to my question, these are all, I mean, especially if we're doing salaries, these are all recurring expenses that we're gonna have every,
We have to look at that. The revenue is not to be considered reoccurring. We can't
Correct.
consider it, cause it's not. This year, we're gonna get more money than we're gonna get next year. We got more money last year than we
Right.
get this year.
Right.
So it's steadily decreasing. That's why we have to ask every applicant, what is your plan? That if you got a recurring expense program, how are you gonna fund this when we're out of money?
Yeah.
And I think the conversation that you missed out on is next year, they've gotta come in and do this again.
Yeah, I did not.
Right.
Because, because when they come in, we wanna know how many programs they accomplished throughout the year. How many children did you get to educate? You know, how many lives did you touch?
We want to
Because-
see some efficiency
Yes.
downstream.
Okay. Yeah, thanks.
Thank you very much.
Very good.
You're welcome. Thank you, guys.
Thank you, Alan.
Yes, sir.
And just to speak on, I don't know if I have permission, but actually the state's gonna require us to submit information to y'all, a minimum of 6 months.
Right.
On progress, like whoever you fund. I mean, you can say every month if y'all choose to, but I think the state requires it.
But we're required some at least semi-annual oversight, yes.
Yes, sir.
So this is the money that we have to spend this year.
You got your own laptop. Will, do you want to come get your hardware?
I do.
We haven't.
And so if I start talking funny or something.
But
That's
that's
right.
from the funds that were initially deposited.
That's right.
No, that was mine.
That's what
This
we
is
have.
not what's been put in this year. These are from the initial funds in 21.
So we have to spend this or we're gonna lose it.
Yes.
That's correct.
Yes.
All right, so you gotta get rid of this money, and then we're gonna get new monies for 22. 2025.
Yep, correct.
And when is that supposed to come in?
I think we already got
Now.
one.
Yeah.
So is that included in, that's not included?
No.
No,
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 this-
you won't
this-
see that.
That's just,
Retrospective.
Okay. But it will be what we get for 2025 is gonna be a smaller number than this.
Yeah, I think so.
is it, okay,
I think so.
That was about
it's about the same.
It's close, it's not appreciably small.
Okay, all right.
All right, let this computer.
So then
do
will we
that,
have to go
because
through and
it's,
do this all again for 2025 then?
Yes.
Okay.
They didn't tell you that, did they?
Glad I asked.
Clear over to slide that page.
Yeah, uh-huh.
Keeps opening the wrong thing. PowerPoint. Well,
I just measure this, I'm not sure I got my point that I was asking really across, but can we split this money up between, like, we don't have to fund
We don't have to fully fund any of
anything,
these,
so we
but
can
need
partially
to
fund some of it.
We can pro rata, we,
Yes,
Okay.
we can prioritize, we can pro rata, we have ultimate authority on.
Okay, spend it how we want to.
Yes.
We can just pick one and fund one.
We
if
can pick
want
one.
to,
Yeah,
if we
okay.
choose to.
okay, y'all, I thought I was gonna do a PowerPoint.
You ain't mess with it?
Well, when I usually use a mouse, I don't use this thing, but look at
Well, the last-
Yeah, I can't
the last
stand
one you
them
had, did you have any
touch
proposals,
pads.
or are these the only
and
proposals we have?
it's in another, a different,
And you should have that.
Was it,
thing that I'm
was it the one
clicking
John
on.
Nichols did?
It was.
Okay.
Well, it's pointed to
Alright.
that.
He's a little bit ahead of the game.
He usually is.
right there, that's a PowerPoint.
But he had some insight into this funding that
Yeah.
some of us didn't.
And what was his
He
ask?
must have had two for
Look
the
at that, I was just on
first
this,
two.
dude. I
couldn't get it to move.
What was the
Defender's office.
Did he have a dollar amount here
Is
that
it
he asked?
his? And he has a multi-year budget on here.
I'm sure he does.
You know what it is, I'm gonna
Is that
have,
not
well, you know,
Next
I'd power
So
down
there
and
it is.
rebuild.
There
There
you
you
go.
go.
There we
Two
go.
ask because he's already into
Here you go.
year one.
Okay,
There's
yeah.
another small grant that's helping to fund year one, and that's the
Okay.
difference in those two.
And these were for social
Social
workers.
workers, master's level social workers.
all right, so, my name's Al Vickers, and, I'm a
Alan, you can pull that chair over if
And
you're
are those
tired of
easy to get?
standing.
You know what, I believe I will.
Yeah, yeah, there you go.
It's kinda
So, I'm with Chase Away Fentanyl,
easier to get a master's
and
level social worker.
I have got a little, booklet that I created on this program that I'm trying to fund. This one's from Franklin County. I apologize for that if you guys.
Alan,
look over
hold
it.
on just a minute till Leslie gets through.
Okay, so,
Go ahead, Alan.
sorry.
So, anyway, I apologize, that booklet is actually from Franklin County. We've already implemented this program in Franklin County. And it's called the New Start Program. And, well, let me tell you guys, some of you may know, some of you may not. Let me tell you a little bit about who we are and what we do and why we do what we do. We're called Chase Away Fentanyl, and Chase was my son, who we lost in 2024, January 16th, 2024, to a fentanyl overdose. And so with that, we quickly realized that at that time, there was very little resources in Coffee County as far as Bradford Treatment Center had left. They wasn't here anymore. There wasn't a lot of resources for people addicted. And so, but the main thing we realized is he passed away in our house. And the main thing we realized is that we didn't have Narcan. You know, we immediately began CPR and, you know, did all the things that we could do without Narcan, you know. And so I told my wife that we had to do something, you know. And so that was our original goal, was to put Narcan in every home in the United States, you know. And of course, we're a long ways from there, but we're working on it. you know, and we're not afraid of it. We're not afraid of the mission. And so, anyway, I'm gonna go ahead and pass that, cause that's Chase. Tomorrow's his 33rd birthday, by the way. And so, I'll talk about our mission a little bit, before we go into the program. It's pretty simple. Save lives is our mission, you know, and however that looks, you know, that is our goal. We're big on education. We do a lot of fentanyl and Narcan or naloxone education. We've got partnerships with, some other manufacturers of some new reversal medication that we're working through, trying to get into the ambulance services. And we're gonna collect our own data to be able to administer these medications. They are prescription. We do have a standing order from a doctor for those. So the New Start program. So what is the New Start? What it is we attract participants from either recovery court and or the county probation department. And we attract them. We will use this funding to help pay their fines and fees. So when they do come out of treatment, when they do come out to reality, you know, I venture to say if you took every resource, every asset that every one of us had in this room, including our vehicle, our driver's license, every dime we got, and no way of getting any, we're all gonna fail at whatever we're trying to do, every one of us. You know, and so what made me, what brought this idea about was my son, you know, he had a drug problem for many years, from the time he went to treatment the first time when he was 14. And almost from that time, he owed some kind of fees or fines till the day he died, you know, but he had been doing well, but I realized that there's like a revolving door there. You know, and it's hard for them to get out from behind that. You know, if you're paying this fine, how you gonna get your driver's license back? Then you gotta get a vehicle, place to live. I mean, all of that goes along with addiction. And I have to tell y'all, I've got 24 years clean from drug addiction, and so I'm in long-term recovery. And I was lucky that I didn't get caught up in the court system. I should have, but I didn't. You know, and so, and I'm not saying that. I believe anyone needs to suffer consequences. That's not what I'm saying. We're not trying to give them a handout. We're trying to give them a hand up. And with this program, for every dollar that they pay on their fines, we will match them for $1. But now there's stipulations. You know, we ask them to volunteer with us. Excuse me. Like the recovery events that Will and Alan were both talking about. We'll set up at those. We'll be set up at all of those, and we'll ask them to volunteer with us. And with that comes hope. It comes a sense of purpose. You know, it gives them something positive. It surrounds them with a community of people in recovery that's got some experience and that can show them a better way and prove to them there's a better way. And so that's the meat and potatoes of the program. The money is simply something to attract them to the program. And so with this, we also are going to have them at our events. They'll have T-shirts, you know, with New Start program, CAF, whatever, and they will distribute Narcan. We're going to train them to use Narcan. That's going to be one requirement, is they're going to be trained to use Narcan, and we're going to let them distribute Narcan. There again, just to give them a sense of purpose, to let them do something positive. I know from being hung in addiction for a long time that, you know, finding something positive to do is huge when you first get clean. I mean, it helps you stay focused, you know, and you know, a lot of times, man, I mean, like on the front of that brochure I handed out, man, it says right on the front, providing hope for the hopeless. You know, and you know, this ain't my opinion. Hope and recovery is evidence-based. You know, there's evidence out there, and it's right in my grant. So I went ahead and went over did a little breakdown of my budget a little bit, and it kind of shows you like what we're paying out of our pocket, what the grant funding is paying. So in order to collect that data that we want to collect, we create a portal, you know, for each county, an online portal, and it's a form. And what we do is we buy what we did in Franklin County, and it's working. And so what we'll do is, like, say the recovery court, if we're supporting people from the recovery court, we will take an iPad to Alan's office, and he'll have an iPad where he can log in, and we've got 2 different questionnaires. That one, we've got it's called a pre-New Start program questionnaire, and it asks several questions, and then there's a case manager application, a part the case manager will fill out, and then there's a part the participant will fill out. And so what that does, and once they fill out the application, once they submit to the program, somebody from Chase Away Fentanyl will interview them. And what we're gonna, I mean, and there's some redundant questions on the administrator's part and on the participants' part, and then we're gonna ask questions and see if they're full of crap and they're lying to us about everything. Like, do you have a driver's license? You know, that's on the case manager's portion, and it's on the participant's portion, you know. And so, but this is, the funding on this, that portal maintenance and stuff is a $15,000. It's a huge undertaking to, we have to hire an IT company to do all that. And so, turn my phone off. I apologize, y'all. I just got hearing aids today, and this is in their Bluetooth, and she's blowing my head off.
That's the first time I've seen it, and that is so funny.
Very good.
And so, but anyway, so, you know, this right here shows you exactly how we're gonna use the grant funding if we're awarded any. And like I said, the biggest portion is grant. I mean, we're asking, I think, $70,000 and some change, but, this is what we're spending on Narcan right here. $97,500 within this program. That's 3,500 doses that we allocate for this program for our
So you've got some
participants.
donations, is that right?
It's from donations, fundraising, however we can get it. I get a little bit from the state. They give me 2 cases a month.
Those statistics on that convention in South Florida, they've had a significant drop in opioid death in 2024, and it's directly correlated to that, the
Yes.
distribution of that.
Yes.
So we are very interested in
And so,
Narcan.
last
distribution.
year, Chase Away Fentanyl, we distributed 4,000 doses of Narcan, in and around Coffee County. We do reach out to Cannon County, Franklin County. We're very active in Franklin County. What other counties? Bedford County, Moore County, Lincoln County, but right here in Middle Tennessee. And, but this $97,000 worth of Narcan right here is a direct, that's for Coffee County. That's it, and that's all, you know. We've already given out over 1,000 doses this year, since January. So,
Do you have a certain plan of distribution, or, I mean?
as far as the Narcan, it's gonna be, and so, when we first started distributing Narcan, we would just go, we've set up in First Division Bank parking lot on a Saturday, you know, and you, believe it or not, there's quite a few people that will stop, you know. And so, what, y'all got anything free? Everybody wants something free. Well, yeah, it's all free. Come and get it, you know. And it gives you the opportunity to present that to them. And so, once we get participants in Coffee County into the program, we will begin to do that again. But also the events like Will was talking about and like Alan was talking about, we'll take them to those too, you know, and let them be a part of that. You know, having fun in recovery, for me, that was a big deal. That was a really big deal. The events and all I used to go to when I was early in recovery, that was a really big deal. And so we want to offer that opportunity for these people. And so we'll talk about hope in recovery. And so hope has proven effects in improving mental health and addiction recovery outcomes, according to a psychologist, however you say his name, who has a master's degree and considerable experience with people suffering from addiction. Hopelessness is a main feature of struggles associated with mental health and addiction. Hope motivates people to seek and complete treatment and lowers relapse rates. Hope helps us think more positively by framing challenges as opportunities for growth and gaining confidence in your ability to succeed. Hope has clear benefits for recovery by setting realistic goals, creating strategies to succeed, developing a plan to obtain your goals, having the confidence to reach your goals. Hope empowers addicts to confront negativity in their life and transform it into something positive. Fostering purpose and providing community support. That's the other thing that we want to provide to these guys. And this is the 5 ways that we will foster purpose and support through the New Start program. Empathize through our experience with addiction, offering our support and resources, encouraging participants to get help, support participants in the recovery process, and provide opportunities to give back. And there's Narcan. Our number one goal at CAF is to save lives. And there it says Franklin County. I forgot, I missed that. We are prepared to distribute 6,500 doses. So I was wrong on that. 6,500 doses of Narcan to Coffee County. Y'all ignore that, Franklin County. Community as part of our New Start program. We have gained a huge following from the community and have successfully distributed over $72,000 worth of Narcan in the past 8 months. We believe Narcan distribution is of the utmost importance due to the fentanyl crisis we are now facing. Narcan allows people the opportunity to live long enough to seek the proper treatment. And this is just a few testimonials from people that we have helped and that's been helped with Narcan. And that's all I got. Y'all have any questions?
How do you categorize Narcan?
How do I do what now?
Remediation or prevention? You know, which category, how do you put that?
You know, death prevention is what it is. I mean, you know, if you want to get right down to it, that's what it is. But now, as far as the remediation for the Opioid Abatement Council goes, it's overdose prevention.
Okay.
Harm reduction, which falls under harm reduction, yeah. I don't like these hearing aids, y'all.
What?
So your other funding sources currently are donations, is that what
Some of them are donations, fundraisers. We are operating on a grant out of Franklin County also. We implemented this program in Franklin County,
the
so.
funds from their opioid abatement funds, is that what you're using in Franklin County?
Yes,
Okay.
yes. And we've got a couple more grants out there, but we've got several more projects, you know, that's gonna happen right here at home too. And I can't announce that yet because we haven't been awarded the funds. But I'm excited to announce to everybody what those are gonna be. And you know, it's kind of funny, me, Will, and Alan walk in here together because all three of us work together every single day, you know, I mean, and so it was kind of funny walking in here, it's like, wow, here's the team, you know.
You got any resistance from the schools trying to put fentanyl in the schools? I mean,
Putting Narcan
Narcan
in
the
schools. I have not approached the schools as of yet.
Wondered.
Judge Carter, I can speak to that. All
Yeah.
of the schools in this district have an opioid antagonist policy in place, and those Narcan, well, actually, we use the Cloxado, the
So
high
it's-
dose.
So it's
in our schools.
It's already
Yes.
established, okay. I wondered about, all
But-
right,
Good, awesome, that's awesome.
all right.
Has it been used in any of the schools?
Not in Manchester City schools. I can't speak about Coffee County or Tullahoma City.
Is it also in Coffee County schools,
It
Narcan?
is, it is.
And y'all don't know if it's saved a life yet? I mean, I'm just curious, in the
Yeah.
school system, can you imagine that? Can you imagine
I hadn't heard that.
being in the school system, being a teacher, a fellow student, and not really knowing what happened? Why did your friend just kill over? But if you had this at your disposal and know how to use it, I think that's
Yeah.
a really good tool.
Yep.
So, y'all look at the grant that I wrote, because I'm like Will, I couldn't figure out how to get all my information in that form. And so I just wrote my grant and attached it to it.
Yeah,
to
we
see attached.
appreciate everybody to come up here and talk to us live, because it would have been difficult for y'all to get your message across based on the templates that, we
Right.
gotta work with what we gotta work with.
Yeah,
So
absolutely.
we appreciate you guys coming up here and
Yes.
filling the blanks for us.
And-
I'm not sure we'd be able to make a right,
You know, so-
sound decision
Don't
otherwise.
think I was being a
No.
smart aleck by doing
No.
that. You know, I was just doing what I could do.
Not at all. So, what we now have is we have several applications that are under consideration, and what we're gonna have to do is we're gonna have to prioritize, I think. Because everybody that's come in here is well-intended, and everybody is deserving of consideration.
Absolutely.
And I think everybody in here realistically understand, even back in December when we first formed this committee, that it was gonna be a question of prioritization. I don't wanna speak for anybody, but, I mean, is that kind of the sum and substance of where we are?
Yes.
Yeah,
I agree with you.
yes.
So I mean, we've got what we need to do our work, now we just have to do our work.
Right.
Are there any more applications? Is this it?
We've covered everything.
Okay.
This is everything before us for now. Now, you know, this, don't know about next year.
I did want to add that recently, Chase Away Fentanyl, and the certification's in there, but it's something I'm really proud of. and I want y'all to know.
What is that?
It's in the package, but, Chase Away Fentanyl was recently certified by the state of Tennessee, faith-based, initiative.
Great.
So we are a faith-based organization.
Great.
Certified by the state. Now, I'm super proud of that.
You done this, right?
So, currently, the way we envisioned this, were that we were gonna receive and review the applications today, and then we were gonna adjourn our meeting until the 12th of March, at which time I guess that's probably when the nitty-gritty is gonna get done, because that's when we're actually, that's when we actually have to decide on what the award should be. Does anybody have any suggestions about any particulars about how to approach that?
Go back over here.
Sure. Thank you.
Yes. Thank y'all so much.
So is that an open forum meeting with every, okay.
So we did not talk about the rubric that they had to evaluate the
Go ahead.
grants.
Yeah.
And we might wanna revisit that.
Yeah.
And if we all had that rubric to work with and put it against each one of
Yes.
these, and when we return with that rubric, I think that
Yeah.
that will help us prioritize and make decisions.
So, we get, just for the edification of everybody, we have some guidance as to how we're supposed to use this money. And that comes in it comes in the rubric. And so what Leslie's talking about is analyzing what we've heard about what the intended, money is gonna be for, and matching those up and prioritizing with the rubric that we've been given on how to use the money. Cause we're charged with using the grant money in a certain way, and we need to make sure that we're faithful to that. So, that's where we are, yeah, I agree with you. And, we have that information, I think it was distributed back at the meeting with the CTAS people.
At our orientation
Yeah,
meeting,
I've
yes.
still got that if anybody needs a copy of it.
I'll forward all that stuff to Jeff
Yeah,
if he sticks with us.
I'll stick.
And I will try to
yeah,
get
have we
your
scared you off
name.
yet?
That's a little scary, but I'll stick.
Your name will be presented to the commission March the 11th, so you'll be, it was full authority on March the 12th.
All right, is everybody comfortable with resetting the meeting to March the 12th of 2025, at which time, at 5:30, at which time we will take up the actual distribution of the grant money? Is
Yes.
everybody okay with that? Do we need more time? Do we need less time, or is March 12th appropriate?
I think
I
we
mean,
need
that's
to go
2
ahead
weeks.
and,
Yeah.
and,
I think
and
I do too.
do this.
I do
March
too.
12th will be the day.
Okay, very good.
That's 2 weeks, right?
Right, and the dollar, what's the concrete dollar amount that we're working with right now? It's right here on the,
192
This is
is
the
on,
one-
it's beyond, we're beyond our deadline on it.
But we're
and to
okay.
show good faith, we need to get rid of
that,
it.
that's what's in play
One
right now.
ninety-two is what we have to allocate
Right
Pretty
now.
at
quick.
this point. Yes.
Yeah.
I'm not sure you couldn't do more right now. I will check on
Okay.
that. I'm
Will you
not sure.
do me
you
a favor,
could.
can you get us, and can you get it to us before the
Oh, yeah.
12th? Exactly, the maximum amount of money that we can play
yes.
with.
I think the next question's gonna be is the 192 is the 2021 money.
Right.
Correct.
We've already got 2024 money, and even if it got to the point where if we allocated those monies and it filled the 192 up, we can make a vote to have it
Yeah.
move to the 2024 money and still fund we can go ahead and begin funding things out of the 24 money.
More than likely,
Okay.
yeah.
So,
We
but
need to
find that out.
confirm with
Right.
Smart, isn't that, the CTAS,
Yes.
entity that, we need to review all that.
Right.
Yeah, I wanna
We
know
don't get
exactly
ahead
how
of
much money that
yourselves.
we have the jurisdiction, I'm gonna use legal terms. I'd like to know exactly how much money we have the jurisdiction to allocate
Exactly.
on the 12th.
Yeah.
And Mayor, you're gonna
That's your
get the answer to that question for us before the 12th also? Or,
I will try to
Okay.
get, yeah.
okay.
And if we
Yeah,
could- if we give us
Trevor,
a couple
you
of days
remember
lead time.
Trevor
I do.
that did our orientation? He's real good to communicate
Right.
with.
If we get that to us about 5 days lead time, so we can be thinking about it.
Okay. Yeah.
All right, well, again, I want to thank the applicants. Y'all have really put a lot into this topic, it shows, and we're going to try to accommodate you as efficiently as we can. Thank you all. I would move that we adjourn the meeting until the 12th of March at 5:30.
I'll second
Do I have a
that.
second? Very well. Very well. All right, I'm encouraged.
Yeah. Yeah, also.
Do